Hi guys, it's Michaela from the Mom and Baby House. I'm with Annalise and we're filming once again in Cape Town. Today we'll be talking to a speech therapist called Lee Wasserfall, and can you give them some more insight into the whole interview and conversation?
Oh, we thought it well to show moms or to explain to moms when it's necessary to get worried about speech therapy, because we don't always know what the milestones are or what it should be, and family and relatives might give us some advice and we're not sure if we're on the right track, and I think a speech therapist is super important.
So today we'll just be clarifying some of those things for you, and we hope you enjoy.
Lee, welcome here. Thank you so much for coming out. And Lee specializes, and she is a speech therapist, as we mentioned in our introduction. And we'll be talking about the how
And the when and the what of speech therapy.
Yes, and everything in between that moms don't know about. So firstly, we of course want to start with what is speech therapy and what does it entail?
Sure. So thank you for having me. It's such a great privilege to be able to share about this area. It's something which I'm very passionate about.
Yes.
And especially I'm about to be a mum myself, so I can really appreciate that.
Relevant.
Definitely.
32 weeks.
So speech therapy is actually a science, and I think that's the first thing that surprises people. We study an honours degree, it's a Bachelor of Science degree in speech language pathology. And so essentially it's involved in the assessment and the management of speech. But then the thing that surprises people is language, swallowing and feeding, and then communication, both social and cognitive communication. And so that's the overarch of what speech therapy deals with.
Yes.
A lot.
It is quite a lot.
I would never have guessed that it included swallowing disorder. Of course, I read up beforehand on speech therapy to prepare myself, but not. If I didn't do the research, I would have no idea. I would just think it's someone that's maybe slurring, struggling. Now, while we're talking about that, I know we're going to touch on the misconceptions about speech therapy. What would you do if you have someone coming over and they want help with their husband or their wife's accent, for example?
So that's a good one, because everybody thinks that speech therapists work with stuttering and with accents. And while stuttering is a hugely important part of our work, accents is not really our work. And there, I think I would refer you rather to an elocutionist or to a public speaker specialist. We do not work in accents. We mainly work in delays and disorders.
Okay, that's always good to know.
Well, let's start at the beginning.
There's a lot.
Just before we started rolling, we were talking about the typical situation that plays out at home. And you might use social media, or you might use your friends or your mom or your grandmother to quickly find out if what you see is a problem. So you would quickly text somebody, or you'll go on a Facebook group and say, well, my child is this age and he will see is not talking. So is that an issue? And then people start commenting, and you were talking about that. And we don't know, when we first-time moms, whether we should get worried at this stage or not. Can you give us the guidelines? When should we start getting worried, and then
focus on age, of course, because that's the moms want to know for everything. At what age?
there's milestones.
So I think that's a really important question, because what we know is that the earlier we intervene, the better. So if moms take nothing home from this video today, is the earlier we intervene, the better. And when we say intervene, that doesn't mean necessarily daily therapy, but it's also providing stimulating environments and enriching environments. Okay. So one of my things that drives me bonkers on Facebook on the moms groups is you see, hi girls, hi ladies, my child is 5 and he's not talking yet. Should I be worried?
Yes.
And then mums are very lovely people, and they say, no, don't worry. Every child develops on their own.
My child is also like
that makes it completely good. So if your child is not talking at the age of 5 years, be worried.
Yes.
Okay. So when we say milestones, as you mentioned, are there for a good reason. And so we have quite gross milestones, but we say about the time a child is 1 year of age, we want them to be using one word. So this could be mama, dada, baba. It doesn't have to be hippopotamus. And then at 2 years of age, we want them to start using them together. So mama, water, or dada, car or something like that.
That's an
So
easy
those
way
are
to
really
remember.
good.
1 year, one word, and 2 years,
Exactly.
2 words next to one another.
Yeah.
Yeah.
As that's from a speech side. Also, very usefully, in your Road to Health cards, there are, which everybody, the Road to Health books, everybody has some milestones, and those are very useful.
Yeah.
That look at specifically at hearing and at responses, and those are very, very useful to
Yes.
keep track of, and that's accessible to all of us because
Yes.
it's in our Road to Health books.
That's amazing. And just to get back on what you said about language, obviously it's not just speech you're focusing on with the services you provide. You also look at social communication
That's pretty
problems.
impressive. You've been reading well.
I'm doing my research. But you deal with those as well.
Yes.
And I just want to see, one of the other areas was cognitive communication problems. Can you tell me more about the type of situations a child would come to?
Definitely. So if we talk about the more communication side of things, the big diagnoses and the big phrases now are, the autism spectrum disorders.
Yes.
And so when we speak about social and cognitive communication, we're talking about things like the non-verbal communication, eye contact, turn taking,
Okay.
problem solving and reasoning, knowing that when to stop, when to start. With the little kids specifically, it's the inside voice. That it's not appropriate to shout like that.
Yes.
Yes.
Okay.
One-on-one. Those sorts of skills that you don't see, but that are very disabling to your functioning in society.
Yes.
And that's a very important part in both children and in adults.
Yes.
The work that we do.
And it's important that you said that, because I did want to mention that all of this information is also useful for adults. Speech therapy isn't just for kids, but of course we're focusing on that because, we're talking about babies, we're a baby business. Hopefully they know that if they're watching this. But also touching on the autism that you mentioned.
Yes.
According to the Lizard Centre, who's a sponsoring member of the Association of Science in Autism Treatment, very long phrase, 2/3 of children with autism that undergo speech therapy see an improvement in their communication skills. How many, out of 10, how many patients do you have with struggling with a problem like that?
So
Where
I
it's
think-
just not...
Yeah, so if we're talking about autism spectrum as a disorder, I think we are, as speech therapists, seeing more and more and more children. That's up for a whole other debate, whether it's been diagnosed more, whether we get better at diagnosis. That's another issue. But what I love about that is the recognition of the merit of speech therapy, because often it's very difficult to measure your speech therapy improvement.
Yeah.
But what we see with these kids is we see them functioning better. We see them making gains in their communication in all those different areas.
And it's also...
That's very positive. That's a very good statistic.
Yes. And is it safe to say that it will help them with communication with themselves as well? And how they can present themselves across?
And able to understand, so what we work a lot on is understanding what is this and how do I communicate it in a way that's effective, not a tantrum or a bite.
Yes, of course. And while we're touching on the disorder side, I feel like I'm saying, well, I'm touching on this, touching on that, but everything slots in so nicely, do you ever get patients that struggle, for example, with Tourette syndrome? Because I know that's something a lot of people and clients we've seen in the shop deal with.
We can definitely, I think maybe the important thing to mention is, as you said in the beginning, speech therapy is actually very broad. It's not just about stuttering. And so technically we are all trained in all areas, but it's really important if you're seeking a speech therapist to actually find out what is their area of interest.
Yes.
And then to find a therapist, because like any doctor, we all have areas of speciality and expertise.
Yes, of course.
And not everyone might be comfortable dealing with children or adults with Tourette's.
Yes.
But to actually make those calls or go online and check out your therapist. I think one of the challenges we face as therapists is people say, oh, speech therapy is not good because they had one bad experience. But you don't write with the whole of the fraternity of doctors, do we, with one bad experience? You would go for a second opinion.
Yeah.
And so I really want to encourage moms is do your research.
Yes, and not always use anecdotal or be anecdotal, if that's the right expression. Because if you know of one situation or one child, it doesn't really rewrite the stats. If the stats is there and it says this is what your child should be doing at a certain milestone, then it's really, really a good guideline.
Yes.
Whether your mom agrees or whether you know of your friend's child that maybe is different. We need to just make sure that we talk scientifically, that we've got evidence-based assumptions. So you obviously deal with schools, you mentioned before the video, with schools and with moms with little babies. What are your average day looks like? What are you expecting to deal with every day? Yes, just so that we can get a picture of a speech therapist's portfolio.
That completely is going to depend where you work. So I now am in private practice and I work mainly in schools. So I see some school children in schools, and then I see my own private patients in the afternoons, those being school children and adults. But prior to this, I worked in a massive tertiary government institution where I worked in ICUs and in the wards all day long.
That must have been difficult on you.
It's just a very different environment. Somebody else might be working in their clinic. So it's very difficult, but my day is mainly outpatient based at the moment, so where people come in to see us, or where I go to see you at your home, and a couple of hospital patients.
So moms will obviously be the first, or their family members, when the child is still very, very small, to notice something. And that needs to be the red flag. If they're in school, usually it's the teachers that notice that something is wrong. Is that what you agree with?
I think that's a very good point you make. Moms notice. Moms tend to notice. You know your child. And don't be in denial. One of the trends I saw on social media was that mum said, is it necessary to go so early? And what about the stigma? So what I want to suggest is you are going for an assessment. That doesn't mean you're committing to lifelong therapy. You'll go for an assessment and the therapist will find, is there something that needs to be addressed? Or if there's not. If there's not, they give you the necessary skills and equipment to go on, and you can leave being equipped and knowing there's no further intervention that's needed. However, if there's a delay or a disorder in your child's speech language or communication and swallowing, then we can address it. And that's what's great. And I think many times mums sit at home and we worry, whereas actually you could go to a good therapist who can either say, no need to worry, or let's do this and then you need not worry. The other thing is parents are worried about the misconception or the stigma. So let me tell mums that generally we're quite nice people. And
Lee is really nice.
Kids like to come for therapy because they experience it as they're going to the auntie and they're going to play and they're going to do activities. The kids experience no stigma. It's you as a parent who often I think feels guilt. Did I do something wrong? Didn't I do X and Y?
But Lee, I would, as a mom, with 2 children, of which Michaela is one, if I could do it all over again, I would be much more proactive. I was a very chilled mom, and when they said Etienne needed occupational therapy, I was like, I don't know if I really agree. And, can I just keep on doing my activities that I'm doing at home based on what science? So, I was just like chilling and just going sort of. Now I would say to the moms, if you just have the faintest feeling that speech or physical, occupational or ADD or ADHD, anything, the sooner you can go, the better. Because I would rather put my little one through all the therapies. They still think it's fun. It doesn't impact them socially. If you wait too long, you have a teenager maybe or a young adult that doesn't fit in, that still has got speech problems or whatever the problem is.
Of course, we focus on speech, but this can relate to so many other problems.
Yes, I just feel, and I know that costs are a big deal here in South Africa, and medical aids maybe do not always pay, but this is the one thing I would never ever save money on again. It is therapy. Just do it as quickly, get that assessment, start the journey, and you'll have adults that are well adjusted and socially accepted. So that's
straight from the mother's mouth.
There we go. this is
Now we
your
can finish up.
announcement. Do you need any marketing? Just take this clip right here. of
Sorry,
what
but
you
it's,
said.
you know, hindsight is perfect sight, so I'm just saying.
Thanks, Mom, for covering the whole interview.
And the important thing is don't wait till school.
Yeah.
I
Yeah.
think that's what parents say, well, I'm sure it'll come right.
Yeah.
Don't wait for it
Just
to
give
come
it time.
Or you're so busy, you know, me, I'm having my own business, and now you've got to still make time for sport, activities, and you've got school, and you've got homework, and then you've got to fit in therapy, and you're just like,
Yeah.
I'm not coping, maybe that can wait. Therapy should never wait.
Yeah.
Leave the ballet classes for a few months. So I raise my point.
Beautiful.
I think the only last thing that I would like to know is what exactly does your services entail? Because now this video is obviously focused on you. If they need speech therapists, if someone watching this is situated in Cape Town, there is a platform you mentioned, actually it's called
SASPA. So SASPA stands for the South African Speech Language Hearing Association.
Yes.
That is a professional body that we as speech therapists can belong to. And they have a very useful website. It's got some milestones and guidelines, but it's also got therapists and
Yes.
their areas of interest
Yes.
listed on there. I currently practice in Hermanus. I know we're so lucky. And Stanford.
For our international viewers,
Yeah.
that is
Yes.
probably about an hour and a half outside Cape Town,
Yeah.
and next to a beautiful stretch
Really
of
nice road
beach. And you can watch the whales there. So Hermanus is very well known for watching whales, and she's got the privilege to live and work there.
So that's where I'm based, but there are excellent speech therapists all over our country and all over our world. There are really excellent speech therapists. So for South African based families, I really recommend this SASHLA website.
Yes.
So it's SASLHA, even though we pronounce it
I'll
SASH.
list it.
Yes, that one, because
Yeah.
it's a good one for typos.
Yes.
Quiet H.
Yes, yes.
That's a very useful database. There are also, on the online platforms, is very frequently people are asking, I'm looking for a therapist interested in an area of, in this area. Also very useful. But I think SASHA is a very good place to start.
Yes. And if a client now specifically wants to come to you, you can assist with, I'm sure, various, situations.
And also
But
just
we-
to maybe give advice and then
Yes.
point them to the right person if it's out of her area.
Yes.
Exactly. And if it's out of my field of expertise, I will gladly
That's
also
what I
just
was
advise.
saying.
Yeah, and I think that's really important. And we as therapists need to nurture that. If this is not an area that I really feel confident about,
Yes.
let me refer you to
Just
somebody
somebody
else.
Yes.
Because
Yes.
there are so many different components and it's a
Yes.
rapidly developing field.
Of course. And where would you more or less draw the line in terms of where you feel you cannot assist anymore? We did mention about the language. I'm assuming that would be
The Tourette syndrome, she felt.
the Tourette's
Oh,
syndrome.
if that was, look, another problem is I am only really proficient to provide therapy in English and Afrikaans, unfortunately.
Okay. So,
So-
you've got Xhosa perhaps or Zulu or...
Yeah. If the children are schooled in English, then often the parents want their therapy to be in English or
Okay.
Afrikaans, and that's wonderful. But if they're not proficient in English and Afrikaans, that is a definite area where I would need to draw the line. And things that are not maybe applicable here, but something like a laryngectomy where people have had their voice boxes removed, I am not
Sure.
expert in that, and I would rather then refer you
Okay,
on.
good to know.
But speech and language in the pediatric population, swallowing, social communication, I love that sort of thing.
Yeah.
Acquired brain injuries, both in the children and adults, I love that field of work.
And
Yeah.
we'll leave Lee's
Yes.
details on the Mom and Baby House Facebook on our database under services.
Yes, and also stay tuned because at the end of this video I'll also slot in her information and a link to her website and also Facebook page. And
Perhaps an area that people are not aware that we
Yeah.
work in, and that is an area called alternative and augmentative communication. Very big words, AAC for short.
okay.
But that's around for people who cannot use speech as their primary means of communication. We can create a communication system for you where you can still communicate, not necessarily speak, but communicate optimally in society.
Wow.
This could be through simple paper boards, but the world of technology is opening up. So we have speech generating devices. And we have computers that can be controlled with the use of eyes, and then they can talk for you and they can communicate for you. So there's a huge tool out there
Yeah.
that is rapidly developing that we as speech therapists actually need to be pushing more. But I think our own insecurities of technology and the resources in South Africa is very real, but that's
It's
a very
fascinating.
important area.
You can hardly wrap your head around that type of technology. You know, praise the people that, you know, invent those. Yeah, yeah. And also the person that thought of it in the first place, shame, sitting there in the corner watching everyone do it. Yeah. Awesome. Do you have any other questions you wanted to add?
I think that's good.
I think I also covered everything.
And we'll move this little bit in, you know, in somewhere
Yes.
into
Yeah,
the
yeah.
sentence
And also
of
not
basic
around
flow.
speech therapy for deaf children.
Yeah, we didn't talk
Mention
about
that.
that.
Do you want to go in? I think the most important for me, thinking that who's going to go on our website, I feel it's not a mom that's got call it a serious
Special needs.
special needs type. I think she'll go to different sources or will be guided to different sources. I think it's more the lay person like me that need to know the milestones and need to know what action they should take and what they can expect. And we didn't talk about that. What can they expect? What will the it's not a course, but the therapy entails. We didn't actually talk about that.
Yes.
You know, you can say to us, it's 45 minutes each, and we usually want you to, have 5 or 10 sessions, and this is more or less what we do, role play, X, Y, and Z. So that we didn't talk about.
Yeah, I was trying to squeeze it in there.
How.
So perhaps to just mention, to give moms an idea of what you can expect in that first consult, that scary one where you've got to go meet the speech therapist.
Yeah.
So
Shame.
first and foremost is perhaps come prepared with a little bit of information about your child's development to date. So little things like how did they feed? Are there feeding difficulties? Have they had any previous surgeries? When milestones like when did they sit, when did they walk, because those all contribute to the bigger picture of your child's development. And then don't amp your children up. They don't have to be well behaved, because often they must come and you speak nicely when the lady asks you, you must answer. And so they come and they're so anxious. So what you can expect generally is that you will have an interview with the therapist and a case history interview. Your child will likely play. There will normally be something nice for them to play with if they are of that age. And then they will do an assessment, which currently our sessions the medical aids only pay up to 1 hour for a session. But an assessment might need to go over more than one session, especially with the younger children where we want to be sure we're getting a really good understanding of their full functioning.
Yes.
Then you should receive a report after those assessments, which tell you what areas is the child functioning well and where are they perhaps behind. And then a therapy plan could commence.
Yes.
I personally see the little ones for not longer than half an hour because I think they can't concentrate for much longer than that. But each therapist has their own way. I normally say to my mums, let's plan a 6-week something. And then we sit down after 6 weeks and we have an honest discussion and say, is this working?
Yeah.
But mums, you need to be engaged in therapy. Your child is with your therapist for half an hour, once a week maybe.
That's just for guidance, but the work is done at home.
The work is done at home.
It's like with everything, homework included.
Yes.
Great.
It's cool. I love it.
Hi guys, if you enjoyed this content, remember to give this video a like, subscribe to our YouTube channel, check out our Facebook page, and stay tuned for our next video coming up. Hope you have a lovely day. Bye.